Uganda Child Cancer Foundation, in partnership with other corporate bodies, is seeking funds to construct a patient hostel. The money will be collected through an annual childhood cancer run that is slated to take place on the 18th May this year at Uganda Cancer Institute. Speaking about the current state of cancer among children in Uganda, Dr. Joyce Balagadde, head of pediatrics at the Uganda Cancer Institute, said the situation is worrying as a result of lack of early diagnosis.
Other people came, including adults, they overran the place, and now children are only 9.1% of the total population of people with cancer that we see at the Cancer Institute. And fast forward to 2012, the institution saw fit to create a dedicated service for children. Before that, children were treated alongside everybody else without any specific attention. But we all know children are not little adults. They actually require very deliberate attention and care if they are to be cured. So in 2012, the Children's Service here at Uganda Cancer Institute was actually born, and at that time we were seeing about 250 children a year. Last year we saw close to 750 new children with cancer under the age of 18 at the institution. Worldwide, 400,000 children and adolescents with cancer are diagnosed every year. 80% of these live in low and middle income countries.
Dr. Balagadde stressed that cancer patients, especially children, require much care and attention, and explained that there is still need for more accommodation facilities.
In the year 2018, WHO launched the Global Initiative for Childhood Cancer, and that initiative was to work towards achieving a survival of 60% for children and adolescents with cancer worldwide. And currently now, internationally, all partners, civil society, the medical fraternity, and others are rallying to make sure that we achieve a survival of 60% for children with cancer across the world. Obviously, there are variations of survival. In some areas in Africa, the survival.
She said about 50% of children suffering from cancer abandon treatment.
The state of this burden is actually seen here at Uganda Cancer Institute. And so that means that 2/3 of our children and adolescents that develop cancer in Uganda are dying somewhere. We don't really know where they are. And so we also have a job to see that more and more children will come into care and have a chance at cure.
Susan Nabakoza, a senior nursing officer at the Cancer Institute, said there is need to increase awareness and sensitization in communities about the dangers of cancer.
As a committed supporter of the 3rd edition of the Child Cancer Run, we are dedicated to helping build a better future for young cancer patients. Our shared vision is to bring hope, joy, and care to those affected by this disease.
She said some people still believe in witchcraft and refuse to take their children to the health facilities. William Ranga, Dennis Kato, Beg Television.